Hello, I am two-time Oscar-nominated actor Will Ferrell. You may remember me from films such as Old School and Anchorman. But enough about me. I am here to talk with you about a very important subject in veterinary medicine. Why are brachycephalic breeds, such as bulldogs, at increased risk for anesthetic complications? You may ask. Do any of you know why? There are quite a few reasons. Pay close attention to me. This may show up on your boards. Brachycephalic breeds have abnormal upper airway anatomy that makes ventilation during anesthesia difficult. Even normal breathing is more work for brachycephalic animals. The most commonly affected brachycephalic breeds are English bulldogs, Boston terriers, pugs, and Pekingese. Himalayan and Persian cats can also be affected. Brachycephalic animals have an inherited developmental defect that is characterized by arrested development of some skull bones but not associated soft tissues. Congenital abnormalities can include stenotic NARS, elongated soft palate, and hypoplastic, or narrowed, trachea, all of which contribute to increased airflow resistance, airflow turbulence, and increased inspiratory effort. Functional airway obstruction via everted laryngeal sacules, laryngeal interference or collapse, inflammation, and edema can exacerbate the problem. Undergoing anesthesia poses risks for respiratory depression and ventilation problems in even the healthiest of veterinary patients, but brachycephalics are extreme anesthetic risks. Brachycephalic animals are more likely than others to have health histories including stertorous breathing, exercise intolerance, gagging episodes, dysphagia, cyanosis, or collapse with stress or excitement. Vagal tone can be increased by many pre-anesthetic, induction, or anesthetic drugs, which contributes to bradycardia and further narrowing of airways, making intubation more difficult. Muscle relaxation and sedation also increase the likelihood that soft tissue in upper airways will droop and thus increase airway resistance or obstruction. The extra soft tissue can also make intubation more difficult for you to perform at a time when establishing airway patency is critical to maintaining anesthesia and adequate ventilation. During anesthesia, overweight animals, and English bulldogs, have a diminished ability to ventilate because tidal volume and functional residual capacity decrease. After extubation, the extra soft tissue of the upper airway can obstruct the airway, and soft tissue interference with large INGL structures increases the risk of aspiration pneumonia. Even the floppy tongue in a recovering dog becomes a risk factor for post-op respiratory complications. Post-op pain and stress can contribute to airway resistance, and therefore opioid reversal may be contraindicated even in patients who are slow to recover. If the procedure involved surgery in the oral cavity or upper airway, there are additional risks due to the possibility of swelling and inflammation at the surgical site. Steps can be taken to minimize anesthetic risks for brachycephalic patients. Provide oxygen through a face mask to the dog before inducing anesthesia or induce and intubate patients as quickly as possible. Give anti-inflammatory doses of corticosteroids immediately prior to or after induction to reduce swelling and edema. Remember that trachea will be shorter than average, so avoid inserting the tube into the bronchi. Avoid choosing drugs with particularly significant respiratory or cardiovascular side effects. Monitor anesthetic plane carefully for any signs of respiratory depression, and provide ventilation support during anesthesia. Hold tongue immediately after extubation to allow for easier airflow. Leave the endotracheal tube in place as long as possible. After extubation, be ready to re-intubate if the dog has trouble breathing. Nasal oxygen administration may facilitate a smooth recovery by minimizing anxiety due to hypoxia. Close monitoring should continue for at least 1 hour following recovery from anesthesia. Thank you for taking the time to chat with me today. I hope you learned a lot, and I hope you see every single movie I make in the future.